Welcome and thank you for joining today. My name is Angelica Cardenas and I'm a health educator for community health at Atlantic Health System. Today's webinar, Atrial Fibrillation, is presented by Connie Mastrangelo and Gail Walker-Sillo, both stroke program managers at Morristown Medical Center. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. You may use the chat button for comments, and if you have a question, please use the question and answer button to post your question. We will try our best to get through all of the questions at the end of the presentation. At Atlantic Health System, we encourage everyone to be an active partner in their healthcare. We recommend using an online tool called MyChart to help you manage your care. MyChart is an interactive tool that gives you 24/7 access to your electronic medical record, and anyone who is a patient at Atlantic Health can open a MyChart account. Some of the more popular features on MyChart are the ability to request your medical records, to access your medical information, including any test results, medications, allergies, diagnoses, the ability to send non-urgent messages to your provider's office and request medication refills or ask non-urgent questions, as well as the ability to access the MyChart of a family member or friend you may be caring for. There are many more features on MyChart to help you manage your care. If you want to set up a MyChart account or need help logging into a current account or have questions about how to use MyChart, there is help available 12 hours a day, 7 days a week.
Hey, good morning. My name is Connie Mastrangelo. I'm one of the stroke program managers here at Morristown.
And I'm Gail Walker-Sillo. I'm the other stroke program manager here at Morristown.
So today we're going to, actually September is Atrial Fibrillation Awareness Month, and we're going to take the opportunity to define what atrial fibrillation is, list at least 3 lifestyle habits that can help reduce your chances of having atrial fibrillation, list at least 2 treatments to manage atrial fibrillation, and then kind of provide an overview of stroke and the relationship between A-Fib and stroke, recognizing the stroke signs and symptoms, and listing being able to list at least 3 modifiable stroke risk factors. Questions can be posted on the chat and will be answered at the end of the presentation.
A-Fib is the most common heart rhythm issue. It is electrical systems that control the heartbeat that are abnormal. The top 2 chambers, which are the atria, beat irregularly, and basically they quiver like jello. They are not moving into the ventricles effectively. When this happens, blood clots start to form in those atria up top. These clots can travel to the brain through the blood vessels, and this is what causes a stroke. This is what causes increased risk of stroke for people with atrial fibrillation. People who have one or more of the following conditions have increased risk for atrial fibrillation: advanced age, high blood pressure, underlying heart disease such as valve problems, hypertrophic cardiomyopathy, which basically means bad heart muscle, acute coronary syndrome, and a history of heart attack. Atrial fibrillation is actually a very common complication after heart surgery, but sometimes people just have a small bout of it after heart surgery, and then you go back to normal. But some people have it after heart surgery, and you stay in atrial fibrillation. People who drink alcohol, especially if they binge drink and they have at least 5 drinks in 2 hours for men or 4 drinks for women, put you at high risk for atrial fibrillation. People who have a family history of atrial fibrillation, people who have sleep apnea have a significant risk for atrial fibrillation, and they also have a significant risk for stroke. Athletes have a very common risk of actually having atrial fibrillation, and people with hyperthyroidism, diabetes, and asthma also have history of atrial fibrillation.
So how do we know if we have atrial fibrillation? So some people don't experience any symptoms at all, ends up being an incidental finding at the doctor's office for your annual checkup. But when you do have symptoms, some of the symptoms that people have expressed that they have is that they feel that their heart is racing or skipping beats, an irregular heart rhythm. Some people feel tightness on their chest, even pain. Some people feel just lightheaded and dizzy for no reason. They feel like they're going to faint, like they're going to pass out. And because your heart is beating so rapidly, then they feel that they're having trouble breathing, especially if they're exerting themselves with exercise. They can feel heart palpitations. Again, the heart feeling like it's coming out of their chest. They can have some sweating with that dizziness and chest pressure. And in reality, the only way that it can be diagnosed is, by or confirmed would be with an atrial with the diagnosis with an EKG. So if you look, when the doctors are, and I don't know, most of you probably have had a checkup at one point, and so the doctor's looking to make sure that your heart is beating in an organized manner. Every time that your heart opens or closes chambers, that's what causes any of those little squiggly lines to go up or down. So this is considered a normal rhythm, and an atrial fibrillation is just, again, as Gail was mentioning before, the atrium is the one that is having kind of like an electrical malfunction, and therefore is now moving or pumping the blood from one chamber to the other to be able to not let it be stagnant and then clot. The duration of A-Fib symptoms. So again, this is now goes to like towards the diagnosis or why, and our goal is to make sure people are aware as to why they might have heard any of these different symptoms. So again, it will be your provider who will let you know if you have paroxysmal A-Fib, is when your heart returns to a normal rhythm on its own, or with treatment within 7 days of abnormality. So people who have this type of A-Fib may have episodes only a few times a year, or the symptoms may occur every day. So again, this will be something that the doctor will determine a plan of care based on the frequency. Now, when you have persistent A-Fib is when you have an irregular rhythm that lasts longer than 7 days. And again, the goal is always to return the heart to the regular rhythm if possible. Long-lasting A-Fib is when you have your heart is consistently in the irregular rhythm for longer than 12 months. And again, if your heart is on the A-Fib for a longer period, then you will require a little stronger treatment with medications, and possibly considering some procedures to reset the rhythm of the heart if possible. And permanent A-Fib is if the condition lasts indefinitely despite treatments, and now we just need to try to control it, as the provider will say. So all types of A-Fib increase your risk of stroke, even if you don't have noticeable symptoms. You're nearly 5 times more likely to have a stroke than someone that does not have A-Fib, and that is related to the fact that the blood that does not move clots and then can travel to the brain.
So stroke is a serious complication associated with A-Fib. It can lead to permanent brain damage if the brain goes without oxygen for too long. Basically, a stroke occurs when the clot forms within the atria, and a piece of the clot, or the clot itself, called an embolus, breaks off and floats up into the brain. And wherever it blocks off, just like a river, nothing goes downstream. So everything downstream from where that clot lands starts to die, and all the tissue within the brain starts to die behind it. When this happens within the brain, it causes a stroke. Clots can also travel to the eyes, kidneys, spine, or within the arms, legs, and it also can travel within the heart muscle itself and give people a heart attack. So there's 3 different types of stroke. The kind that we're talking about having a clot is the ischemic stroke. You can also have an intracerebral hemorrhage, which is bleeding in the brain. So sometimes you can have a clot go into your brain, and it actually can cause so much damage that you can have an intracerebral hemorrhage from that. Or you can actually have a subarachnoid hemorrhage from that if you have so much dead tissue. So some subarachnoid hemorrhage is around bleeding around the brain. You can also have what we call a TIA. So a TIA is basically, at this point, diagnosed by having an MRI or a CAT scan. And it is not, we used to say that it was just an episode of stroke-like symptoms that went away within 5 to 10 minutes. But we actually know now that patients can have strokes and have the episode go away within 5 to 10 minutes. And it is a patient that has a clear radiology exam. So you have to have a clear MRI for it to be diagnosed with a TIA. So this is know the signs and symptoms of stroke. It used to be just FAST, which is face, arm, speech. And we've actually extended it out to be BFAST. And so to give you balance, which is balance difficulty and dizziness, eyesight changes. So if you all of a sudden have double vision, loss of vision, and particularly in one eye, those count for the strokes that happen in the back of your head. So if you have vertigo, dizziness, if you have impaired coordination, those are stroke symptoms of the back of your brain. So if you have speech issues, facial droop, if you have weakness in one arm or one leg, and now we've also added terrible headache. So it's a sudden terrible headache with no known cause. Or if you have neck pain where you can't put your chin to your chest, those we worry about you having bleeding in your head. So those are reasons to come to the ER and get checked.
So if you observe any of these symptoms, please, don't brush it off, don't go to bed, just make sure you call 911 and get checked out, especially when it's a sudden onset.
Right. We have a lot of people who we say they lay down and take a nap to see if they'll get better. And lying down and taking a nap, all of the treatments for stroke are time sensitive. So you lose 32 million brain cells per minute. And I don't know about you, but I can use all the brain cells I can keep. So what we need to know is, are the symptoms new? When were you last seen normal? Where were the symptoms witnessed and what time did they specifically start? And don't think if you drive here faster than the ambulance that you'll be seen faster. Anybody who comes in via the ambulance, we hear about it from when they're in the ambulance. So everybody starts to mobilize even while you're in the ambulance.
So it's still faster care if you arrive via ambulance. So again, since we have the two different types of stroke, for ischemic stroke, the treatments that we currently have are a medication called a thrombolytic, which is a massive clot buster, is time sensitive. It has to begin within a specific time frame before, we can increase the chances of creating a hemorrhage if we give it too late. So it's a medication called thrombolytic, or a mechanical thrombectomy, which is actually a procedure which a neurosurgeon will insert a catheter through the groin area or the wrist and advance it all the way to the brain and remove the clot. The clot obviously has to be present in one of the large vessels of the brain for them to be able to access it at this time based on the size of the catheter. So in here you can see, the medication is given via a needle that is placed in your arm. And we have the two devices where they can do the mechanical thrombectomy. It's a stent. One of them is a stent, but contrary to the ones that are utilized for the heart, they do not stay in place. They're just temporary to kind of entrap the clot and then allow some blood flow distally to the area of the occlusion to try to salvage that tissue that is at risk of dying. And then the catheter is pushed back or pulled back with the clot in it. The other one is a suction. It's like a vacuum. That then again, the goal again is to remove the clot from the area. And then we have the treatments for hemorrhagic stroke. Again, everything, just the quicker you seek for help, the better the outcome will be. So sometimes, blood is an irritant to the brain cells, so it can cause inflammation. The brain is enclosed within the skull, so they can do procedures to relieve a little bit of that pressure by making, an opening. They can drain, depending on the location of the hemorrhage. They can sometimes drain the pool of blood. They can put different catheters, to just help balance The pressure piece, if it is an aneurysmal bleed, they can do coils, which is basically filling the space of the bulging that caused the aneurysm to prevent it from filling with blood. Or they can do these little things that are on the neck of the aneurysm. They actually do a clipping. So those two do stay in place if they're utilized. These are advanced procedures done by the neurosurgeons. So we want to know about the stroke risk factors. Are we aware of what the stroke risk factors are and what we can do to prevent it? So the stroke risk factors get divided into two types. So some of them are the non-modifiable, which are the ones that you cannot control, such as age, gender. 55,000 more women experience stroke annually. Having had a prior stroke, a prior TIA, prior heart attack, your race, and family history of stroke are things that you cannot change. However, there's modifiable risk factors such as hypertension, diabetes, high cholesterol, atrial fibrillation. As we say, it increases your chances of having a stroke 5 times. Carotid artery disease, which is the main blood flow to your brain, to the anterior part of your brain. Smoking, vaping, drugs, obesity, physical inactivity, diet, nutrition, and alcohol use. So these are things that if you can do something to prevent it, to prevent the deterioration of the organs by not controlling it. So the highest or more powerful determinant of stroke risk is the hypertension. So uncontrolled blood pressure damages the integrity of your vessels, and as a result, it compromises how everything flows.
So stroke risk assessment. So everybody has their own risk assessment. So if you score higher in the risk column, you're unsure of your risk, you can ask your healthcare professional about how you reduce your risk. There are risk assessments on the Atlantic Health webpage. You can do your own risk assessments under patient a family. So you can do, if you're a higher risk, if your blood pressure is greater than 120/80, again, that A-Fib, is your blood sugar greater than 100? Also, if your hemoglobin A1C has ever been greater than 7 or 8, what's your body mass index? Is your diet high in saturated fats, sweetened beverages, salt, and excess calories? What is your total blood cholesterol? Have you ever been diagnosed with diabetes? Do you get less than 150 minutes of moderate or vigorous exercise per week? Do you have a family history of stroke, TIA, or heart attack? Do you use tobacco or vape? All of those are at higher risk. So answering yes to multiples of those, you're definitely at stroke higher risk.
So we're going to quiz ourselves. So again, it's about recognizing. So most strokes are preventable. It's about, treating and managing the risk factors. So we want to make sure that we know, is it sudden? Is any issues with your balance? Is the person suddenly having trouble with balance or coordination? Are you having sudden difficulty with your vision? Are you experiencing sudden blur or double vision or sudden loss of vision in one or both eyes? Face, you're always looking for symmetry. The brain is quite complex, and when it comes to motor sensation, we are crisscross. If we're having damage or an affected area on the right, then the left is where the symptoms will be versus the left, and then you will have the symptoms on the right. There's all different centers that are managed, and they have their own little compartments, so that's where the symptoms will come from. You can have arm or leg asymmetry, meaning, normally the symptoms will be in the same size. So it will be the right arm, the right leg versus, opposite. So again, it's a sudden change. Speech, can the person be understood? Can they understand and follow commands? So we have different centers in our brain that control our speech. Some of them help you producing the speech, and some of them help you with the articulation and the ability to form coherent sentences. So they could present in those different ways.
And sometimes if you have somebody that's having difficulty speaking, they can text. So those two different parts of your brain is to text or write versus speak. So if you have a family member that ever has trouble, they can write, they can text. So that's just a little tip.
And then T is mentioned for terrible headache. So is that the worst headache of your life of an unknown cause? And the most important thing is that you need to make sure to see when these started and when was the last time you were normal, and call 911 immediately to be able to get treatment and improve your outcome. So there's a couple of things we'd like to highlight: the stroke myth versus reality. So the myth is that stroke is not preventable, but the data shows that about 80% of all strokes are preventable. People think that they cannot be treated, and strokes can be treated. They require emergency treatment, but our treatments are time sensitive. So the faster you get to the hospital, the better outcomes or ability to qualify for treatment are. People think it happens in the heart. Well, a stroke happens in the brain. So a stroke it's like a heart attack. It's a clot in the heart, killing the heart muscle. A stroke is a clot in the brain that can kill the brain cells. And again, and if you have a hemorrhagic stroke, it's just from the inability to receive oxygen because the blood is leaking out. Recovery ends after 6 months. Well, stroke recovery can last a lifetime. So there's always, rehab can help long-term rehab for patients to be able to regain or relearn some of the tasks that they might have lacked after a stroke. So now we're going to go over some of the atrial fibrillation treatments. So one of the biggest, and again, this will all be based on the different types of A-Fib that we covered before. Your provider will work with you to train with the cardiologist to make sure that they prescribe the best treatment for you. So kind of like the first line of defense is blood thinners. They're the most effective treatment to prevent blood clots and therefore decrease your risk of stroke. Taking an anticoagulant medication can reduce the stroke chance by 50 to 70%. Warfarin or Coumadin is probably one of the oldest medications or anticoagulant use, but it does require some monthly blood work to check to see if the level is therapeutic. And we now have newer anticoagulants such as dabigatran, which is the brand name is Pradaxa, apixaban, which is Eliquis, and doxaban, which is Avesa, and Lysiana, and Ravito, which is Xarelto. But those are newer anticoagulants that do not require that follow-up blood work. Some of them are taken once a day, some of them are taken twice a day. And again, it will be determining the source of your A-Fib or the grade that you have, the grade level of the A-Fib. Your provider will determine what anticoagulant will serve best for you. So some people cannot take anticoagulants because they have a high risk of bleeding. And in some cases, a small mechanical device can be placed in the left upper chamber of the heart to prevent clots from leaving the heart. It's like a filter. The best medication will depend on your individual situation, history, and risk factors. So again, this is just information, just so you know what is out there. Additional treatments, procedures to correct A-Fib. So again, if the medications, they can do the anticoagulant to make sure the blood doesn't clot as much. They can utilize medications to control the speed of the rhythm, the heart rhythm. They can utilize treatments now that can be, one of them is called a cardioversion. So it involves applying a mild electrical current to the heart to kind of reset it. So that's obviously, this is all done by providers. It's not, people can do it themselves. Most of the time it will be done by your cardiologist. Just skip, apologize for that. They can do a treatment called ablation. Again, this is, it kind of like shocks the area that is malfunctioning. It's a radio frequency. Or they have another device that is called a pacemaker, and that is implanted to try to control those rhythms that go too fast. So the American Heart Association, Stroke Association, obviously there's a huge link between the heart and the brain. And one of the things that has been identified is that A-Fib does increase the risk of stroke. So now they're doing this initiative calling shared decision making. And what it is try to bring awareness of the community to make sure that they work along with their provider to determine a clear plan of action to treat their atrial fibrillation to prevent the complications of it, one of them being stroke. So again, by having a clear plan and adherence of treatment can improve your cardiovascular outcomes, and it can also decrease your risk of stroke. Some people can reduce their chances of having A-Fib again by controlling their blood pressure. Again, want to make sure you keep the rhythm steady, avoiding or limiting alcohol, cutting down on caffeine, getting treatment for an overactive thyroid gland. Again, these are all correlated to those signs and symptoms in people that are at risk based on these things, losing weight, and reducing stress.
So again, understanding A-Fib tips for a healthy life, increasing physical activity, eat a healthy diet, and care for your mental well-being. Increasing your physical activity. Again, eating a healthy diet. Stroke signs and symptoms. So again, these are the be fast with a balanced eyesight, facial droop, arm, speech, and terrible headache. Don't forget to call 911. These are the stroke system programs. If you have any questions for Overlook, Morristown, Chilton, Hackettstown, and Newton. And if you have any questions, we thank you for your time and attention.
In that case, thank you all for joining us. We kindly ask that you take a few minutes after today's webinar to complete a program survey that will pop up once the webinar closes. The link to the survey will also be added to the chat for your convenience. Thank you so much, Connie and Gail, for dedicating your time and your expertise today. If folks have additional questions or comments, they can send an email to communityhealth@atlantichealth.org. And that is all. That concludes our webinar. Thank you, everyone, for participating. And we hope that you join another one of our programs. Thank you so much.
Thank you for your time.
Thank you.